Asthma talk number 8. We were talking about what to do if the patient seems to be struggling with their asthma and having an acute attack. The patient should be advised to try and sit down and remain calm. Shortness of breath is a frightening symptom, a very frightening symptom, in fact. And if a patient starts to get panicked, they will, without realizing it, start to breathe faster, and this may just start a vicious cycle and make them feel even more short of breath. So the person who's with the patient tells the patient to sit down and try and take slow, deep breaths, because panicking is not going to help. It's very important to have the blue inhaler, the reliever inhaler, and the person is advised to take one puff of that approximately every minute, so every 30 to 60 seconds. So if the person has what we call a spacer, which is a plastic tube often given to children, but even adults can use them as well, a plastic tube where the inhaler is put at one end, and at the other end of the tube is the mask which the person puts on their face, then providing that spacer is reasonably clean and doesn't appear to be clouded up with white mist on the inside, which is a sign that it hasn't been cleaned recently. If it's reasonably clean, then a spacer can be used, and the important thing to note is that the person gives themselves 8 to 10 puffs of their blue inhaler. In between each puff, then the patient takes about 8 or 9 slow breaths to let it settle into their lungs, and then they give themselves the next puff up to a maximum of 10 puffs. So there are 10 puffs, and in between the person breathes normally. It's also important to note as well that each time the person has a puff of their inhaler, they have to take their inhaler out of their mouth or out of the spacer and give it a good shake before they give themselves the next puff. The reason being that if they don't shake it in between puffs, all they may get is the propellant gas coming out rather than the medicine contained inside. So they give themselves up to 10 puffs, and in many cases where a patient is having an acute attack, that will settle the breathing down and the patient feel a lot more comfortable within a few minutes, literally. If, however, that does not give relief and the patient, a few minutes after giving themselves the 10 puffs, is still feeling very short of breath, then it's important not to waste time, and at that stage the person or the person who's with the patient should call 999, call an ambulance, because the patient may need stronger medications. Whilst waiting for the ambulance, if there's any delay, then the person can have another 10 puffs with the same instructions as before. Take it into the mouth or into the spacer after having shaken it, and after giving one puff, then a person has 8 or 9 slow breaths to let that medicine settle in. It's important to act quickly when the patient is having an acute asthma attack, because asthma can deteriorate quite quickly. But likewise, rapid treatment with the blue inhaler can be life-saving. Uh, Regardless, if a patient has an acute asthma attack, the patient will need to see a doctor, and we'll talk about that in the next talk.